Hi, everybody. My name is Dr. Chris Peterson, and I am the owner and operator of DePere Smiles up in West DePere. We are a general dental office, and we have a little bit of a niche specialty in talking about tongue ties and treating tongue and lip ties and cheek ties in infants and children and adults. So, it's a pleasure speaking with you guys tonight, or today, I should say. At this Mom and Me course. So, if you're at a Mom and Me course, that means you have a little one or little ones, maybe if you had twins or triplets, for goodness sake. But no, congratulations. Welcome to parenthood if it's your first baby. Otherwise, good luck with having multiple. It's a lot of fun. I got three little ones of my own at home. And to be honest, that's the reason why I got into the whole tongue and lip tie world, is because of my oldest daughter. She was about 7 weeks old, and we were breastfeeding at that point. It was going okay, but she had painful gas when we laid her down to go to sleep. And my wife said, something's not right. This baby shouldn't be so fussy all the time. And we looked into it a little bit. We had a lactation consultant come to our house from Outagamie County, and she said tongue tie. And I thought, what in the world are you talking about tongue tie? I'm a dentist. I'm the one that knows about the mouth more than you, but I didn't have any training at all, like I said. So we looked into it a little bit more, and took a bunch of courses and been all over the country getting trained. It's been a lot of fun learning about tongue ties, and then a lot of airway stuff too, and how a tongue or lip tie can impact a child or an adult later in life if it's not fixed correctly. So we really pride ourselves in educating, people like you, other medical professionals in the area, whether that be pediatricians or therapists, speech therapists, lactation consultants, just a lot of professionals, and we've had a lot of people come in and watch what we do, and it's been a lot of fun over the last 5 years since we've started doing this. So anyway, what I wanted to do was just talk a little bit about the essentials that you guys should know as parents about what a tongue and lip tie actually is. What does that mean? How can it impact your child now or in the future, or maybe even in the past, with some feeding issues? But we'll go through a couple different things. We'll talk about what's normal inside a baby's mouth, what's not normal inside a baby's mouth, which means when do we actually call it a tie? When I say tongue tie, cheek tie, lip tie, and when do we not call it that? So we'll go through the terminology and make sure we're all on the same page. Second thing we'll talk about is breastfeeding or bottle feeding mechanics for the little one. Just a brief overview of the tongue movement, upper lip movement, what it should be for a proper latch. And then we'll go through a little bit of warning signs that we're going to look for in the baby's mouth when we do an exam here, and why they might be there. So we'll talk that all through. And then, when I have a patient in the office, what we do is we do the exam, and we have a feeding assessment with our lactation consultant, and we just make sure everything's going okay. And we put all the pieces of the puzzle together to get a full idea of what's going on. The feeding assessment, whether that's breastfeeding or bottle feeding, the exam that we're going to do, and then the symptoms that the parents are reporting, whether that's for the baby with gassiness, fussiness, spitting up, stuff like that, or for mom if they're breastfeeding. A lot of times moms are in pain if it's a shallow latch. So we go through all that, put all the pieces together, and then just let them parents know our recommendations. And we're very low pressure, so we just like to educate, and we can do some treatment that day right away, because it doesn't take very long if the parents decide to do that for their little one. So let's jump into it, guys. I'm going to keep it simple for you today. Every single one of us has a little strand of tissue underneath our tongue and on our upper lip and on each cheek. They're called frenums or frenulums, and that's just the word or the words you're going to hear to describe connective tissue that covers different muscle attachments that we all have. So it's very normal to have that tissue. We all have it, but that tissue sometimes can restrict movement of the tongue or the upper lip, cheek area as well, and therefore we could have functional issues because of that restriction. That would be breastfeeding, bottle feeding, eating solid foods, speech, dental development. I mean, a lot of things, not just now, but down the road, that restriction in movement could cause. So the key to the definition of a tie, when we say tongue tie, cheek tie, lip tie, is, do those frenums cause problems? If they do, we're going to use the word tie or ties, and we're going to recommend fixing something 100% of the time if we call it a tie. So when we talk about breastfeeding or bottle feeding mechanics, I always start with the tongue movement for the little one. Their tongue is just a wave-like motion, during feeding. And if you break down the movements of that wave, it's really simple. We want forward and upward movement of the tongue in a nice coordinated fashion to make up a wave. We call that protrusion and elevation. A little bit of backward movement of the tongue called retrusion. That's important for swallowing. But at this point, we really just want that forward and that upward movement when the baby's really little for breast or bottle feeding. All right, so we want that forward and that upward movement in a nice coordinated fashion to make up a wave. Now, here's a proper latch for a baby. What their tongue needs to do during feeding is it needs to go forward over top of the lower jaw where the teeth are going to erupt and underneath the breast or the bottle, nice and far forward. That's number one, a really important movement that we need. Number two, we need that upper lip to flange out over top of the breast or the bottle to maintain a nice seal or form a nice seal. Okay, if that upper lip is kind of tucked under, or if it's just kind of in a neutral position and not flanging out really nicely, it's going to restrict the baby's movement, and it's going to restrict the size of their mouth really, and it's going to create a more shallow latch because we can't get as much breast or bottle in the baby's mouth versus if they had nice flexibility and a bigger mouth. So once we have that tongue going forward, upper lip flanging out, boom, that gives us our suction. Now some babies really struggle maintaining that seal. The way that they need to do it is they need to elevate that tongue, cup it right around the breast or the bottle, and maintain that suction. Once they do that, it's really easy. They just do that wave-like motion with their tongue, and it creates a vacuum-like pressure that draws milk out of the breast or the bottle. So it's all about a vacuum, guys. And if you think about it, how important to any vacuum is suction being maintained? I mean, it's everything, right? So if we're maintaining suction, it's going to be a piece of cake. If we can't maintain suction, we're going to have major problems. And the questions that we always ask to see if baby's maintaining suction or not include clicking noises during feeding or smacking noises where you can just kind of hear the suction breaking. That's a problem. The second problem, or the second thing we ask is there milk leaking out of the baby's mouth during feeding? You know, if they're trying to suction best they can and milk's just pouring out of their mouth, that's a sign that the seal is not good. Another question is, do they latch and delatch a lot? You know, are they on, off, versus just getting on and staying latched? Because every time they break suction, you know, or every time they delatch, there's a break in suction. So all those questions that we ask kind of point toward babies really having a tough time maintaining a seal. And then we get major issues. 3 in particular. Number one is inefficiency. Some parents report that it takes 45 minutes or an hour to feed their baby. And I always say, ain't nobody got time for that, right? 5 to 10 minutes will be great to either drain the breast or the bottle, okay, per breast. So if it's about 20 minutes and we're doing both breasts, great. But if it's taking a half an hour or 45 minutes because maybe you got to stop and your baby's really gassy, you know, you have to burp them, that's not normal. So problem number one is inefficiency if we're breaking suction repeatedly. Problem number two is ineffectiveness. When moms especially are breastfeeding, they just report baby can suck for, you know, a half an hour or longer and they just still don't feel like their breasts are drained. And that's a problem. We need baby to get what they need and drain the breast in a short amount of time. Okay. The third problem is if air enters that airtight seal, it goes right into their tummy, and then we get gassiness, fussiness, colic, spit up, hiccups, all because baby's swallowing too much air. So it's really, really simple. We want to make sure baby can move their tongue forward and upward and flange that upper lip out to form and maintain good suction. And once we have that, baby should be able to get what they need in a short amount of time without swallowing a lot of air. Really simple. Okay. So some warning signs that we're going to look for when we look for you know, a tongue or lip tie. Four in particular. Number one is nursing blisters on the baby's lips. If there are chapped lips for the baby, it tells me that there's friction there on the lips during feeding, either on the bottle or the breast, and they should be flanged out. You should be able to visualize that part of the lip that is chapped. But if that lip's kind of tucking under, or if it's not flanging, there's friction there, and then we get chapped lips. So that's kind of a warning sign that we have a shallower latch than we want. Number two would be a white coating on the baby's tongue, which is absolutely not normal. White coating on the tongue could either be thrush if it's fungal. Usually that's easy to spot and easy to treat with an antifungal. But if it's a milk coating on the baby's tongue, it should not be there for a long period of time. More than, you know, a couple of minutes after feeding, just a little milky residue is normal. But if it's a coating that stays for a while, it tells me that the tongue is not elevating during feeding, because the tongue should be self-cleansing and staying pink. The tongue is pink, I always like to say. It's not white, so it shouldn't be white. But if the baby, you know, if the breast is here and the baby's tongue is here, we want the tongue elevating and rubbing itself clean, doing that wave-like motion and staying pink. But if it is locked on the floor of the mouth and it's doing the wave down here, nothing's ever going to clean off that tongue on the top of it. And then we get that white coating that can be pretty tough to clean off. Another warning sign that we look for with the baby's growth and development is their upper jaw shape. Okay. So all the way from when baby's in the womb to when we're an adult, you know, all the way through childhood, we should be suctioning our tongue to the top of our mouth when we're not eating or talking. And now you're going to think about what you're doing right now as you're watching this video and what you're doing when you're sleeping. But really what we need to do is have our lips sealed, breathing through our nose, tongue suctioning to the roof of our mouth, And what happens is that upper jaw is widened by that pressure from the tongue, and it lowers as it widens. So we don't want a narrow and a high upper jaw. If this is the cross section of your baby's jaw, we want it to widen and lower over time. That's going to help proper orthodontic development, so our teeth can come in the right positions. That's also going to help, nasal breathing, because your nasal cavity will form properly. So, we'll feel the baby's upper jaw, and if it's narrow and high, that's a sign that, their tongue has been locked on the floor of their mouth, potentially because of a restrictive frenum or a tongue tie, and it hasn't allowed that upper jaw to form properly. When we feel the upper jaw, the fourth warning sign is if the baby's super gaggy and they gag immediately when we touch the roof of the mouth, that tells me that they're not used to that tongue stimulating the roof of the mouth with that suction type movement, and they're not used to pressing the breast or the bottle into the palate because maybe they can't elevate their tongue. So, we don't want a gaggy baby, because that's going to have problems with eating solid foods and brushing your teeth and going to the dentist and taking x-rays. We see those patients all the time, and when they're really gaggy, and it just creates a lot of problems for them. So those are the 4 warning signs. If we got nursing blisters on the baby's lips, if there's a white coating on the tongue, the shape of the upper jaw, if it's narrow and high, is a problem, and then a really gaggy baby too. So those are the kind of brief overview of what we look for when we do the exam, when we see a baby in the office. And we kind of talk it through with the parents. And like I said, we just love to educate when parents come in here. And that's why I'm doing this right now, is because we just want to spread the word about what we're looking for. And it's not rocket science. Is that tongue, restricted by the frenum underneath it, and not allowing it to actually have the full capabilities for breastfeeding, bottle feeding, eating solid food, speech, growth and development, all those things that we want down the road. And is that upper lip restricted as well? That's what we look for in the office. And it's a really quick, easy procedure with a laser. If we end up recommending that and the parents want to go ahead, it takes us 30 seconds and we're done. And then hopefully we change their lives for the better. And we do it every day, and it's a lot of fun. So anyway, I just want to say thank you so much for paying attention. I know it was a little bit longer of a video than maybe you wanted, but I just wanted to talk about those main things, and hopefully you learned a couple things. If you ever have any questions about anything, just let us know. Reach out to the office,